Howdy, howdy, this is Tony Potter. I'm here with my FHIR demonstration presentation for my 6440 class, fall semester. So a little bit about myself. Currently, I am a software designer. I'm working for the Department of Defense. I'm working on a surgery scheduling system, maintaining the surgery scheduling system used throughout 53 different hospitals in all three service branches. Formerly, I'm a high school and college math teacher as well as a high school computer science teacher. And I took this course because it's part of the information intelligence package, but also it's very pertinent to my current job, and so I thought it'd be a wonderful course to take. So, a little bit about what FHIR is. FHIR stands for the Fast Health Interoperability Resources. So what we're basically talking about is a way of transferring data as objects. So we're going to be talking about different types of objects, such as patient objects, medicine objects, outcome objects, procedure objects, etc. And I'll go through more examples. But the main idea is that this allows interoperability. It allows electronic transmission of health records, either using a JSON format or XML formats. And this helps to satisfy stage 3 of the meaningful use criteria for the HITECH Act. That's the Health Information Technology for Economic and Clinical Health. So this allows us to store information, to transmit information regarding different health records. So what I've got here is the URL that we're going to be talking about. This current implementation of FHIR allows us to search for things. So I'm going to go through some examples real quick. So here's FHIR right now. I'm going to move this off to the side. So first thing I want to do is I want to search for a particular patient. Now this is the patient that we're focusing most of our course on here. So I'm going to go here and search for a family name. I know her last name is Dixon. And so when we actually go and search for this, we're going to find a whole bunch of Dixons, but what we're interested in, or rather I should say who we're interested in, is Marla. And what we're going to notice about Marla Dixon is that she has this ID number, this 523050, and it's really convenient to know that all of these data are kind of indexed on different values, and patient ID value is one of those values that everything's indexed on. So knowing this patient ID, I could come down here to, say, observations, and I could search on that patient ID, 523050. And when I do this search, I'm actually going to come up with quite a few different observations. So you'll see these observations have different numbers on them. And clicking on some of these observations, I can click on this read observation down here and find out that on a particular date, so this April 23rd observation, she had a chest x-ray, which we noticed was hyperinflation and a depressed diaphragm. So that's one of the other things I can do, not just searching for a patient, but I can also find out different observations that took place, and I can also take a look at different medicines that were ordered. So I could go down to her 52050 and I could search for medications that she was prescribed. I noticed that she was prescribed 3 different types of medication, so I can click on one of these medications and find that she was prescribed propranolol, and she's allowed to have 4 refills of 90 pills each. She got 60 milligrams of that in an extended release oral capsule. So I can search for all of these different aspects, and notice that these are all treated. I've got these currently being displayed as JSON objects, but I could just as easily switch them over to XML objects and do the exact same search. And what I'll notice down here is that, okay, now they're being stored as XML objects. Some of the things we found out about her. We've been able to find out her address and her birth date, who her provider is, who she gets her service through. The onset, these are 4 of the conditions that she developed. So she developed bronchitis, arteriosclerosis, diabetes, and hypertension. We currently have 3 doctor's visits here in our hospital, and we can tell some of the medications that were prescribed on different dates. Some of the other things we can do is we can actually see what happened during the hospital visit, some of the measurements that were taken by the physician. So I can see that her heart rate, I can see her blood pressure, some of the other blood medications, and this is true for each of the visits that she did. So what is FHIR? FHIR really allows us to exchange information between health providers, and it also allows us to take care of personal health information. And the main focus here is the stage 3 for electronic health records, the idea that we're looking at PHI security, we're looking at electronic prescribing. There are certain benchmarks that have to be met for all of these. Clinical support decisions, not just one doctor, but we can look about whether or not we have drug interactions. We can talk about computerized orders, if we're talking about medical orders, lab orders, imaging orders. Patients are going to have access to their record. There are certain benchmarks for that as well. We can coordinate healthcare through patient engagement. So if a patient has multiple doctors, we can take care of that as well as public information reporting and health information exchange. So those are a lot of the features of FHIR, and it's a very important system. It's essential for us to have this type of interoperability. So once again, this is Mr. Potter. Thank you for watching. Have a great day.